We all love our cats, right? Of course we do. But there's this hidden enemy that almost every single one of them is going to face at some point. It's an internal parasite, and it's way more common than you'd think. Today, we're pulling back the curtain on the feline roundworm. Let's get into it. So, let me ask you something. What do you think is your cat's most common unwanted guest? And no, it's probably not what you're thinking. It's not fleas, it's not ticks. This little freeloader is an internal stowaway, and it is incredibly good at what it does. The answer? Roundworms. And the scale of this problem, well, it's kind of shocking. At some point in their lives, up to 75% of adult cats will get infected. Just let that sink in for a second. That's 3 out of every 4 cats. This is not some rare thing. It's practically a given.
So let's properly meet this common enemy. The scientific name is Ascarids, but we just call them roundworms. Let's get a closer look at what we're really up against here.
You know, what makes this parasite so successful is just how tough it is. Ascarids are the most common worm parasite in our cats, and their eggs have this super tough outer shell. This means they can just hang out in the soil totally fine, waiting for a host, for months, or get this, even for years.
And we're not talking about some microscopic invader either. Inside a cat's stomach or intestines, a single adult roundworm can grow up to, are you ready for this? 5 inches long. Yeah, it's a pretty unsettling thought, isn't it?
So how does this even happen? How does a teeny tiny egg in the dirt end up as a 5-inch worm inside a cat? Well, it's a fascinating and honestly kind of sneaky life cycle. Let's trace its secret journey.
Okay, so follow along here. It all starts with microscopic eggs shed in an infected cat's poop. Another cat can swallow those eggs, maybe from contaminated soil or by eating, say, an infected mouse. But here's where it gets wild. The larvae hatch and actually migrate through the body to the lungs. They get coughed up, swallowed again, and then they finally grow up in the intestines. And the cycle has another trick up its sleeve. Dormant larvae in a mother cat can wake up and pass directly to her kittens through her milk. It's an incredibly clever survival strategy.
Now, there are actually 2 main types of this parasite. Toxocara cati is the really common one we've been talking about, the one with that clever trick of passing through milk to kittens. But then there's Toxocara leonina. It's less common, and here's the absolute key difference. It is not passed from a mother to her kittens through milk.
Okay, so we know how they get in, but how can you tell if they're already there? Let's talk about the warning signs, what you, as a cat person, should be keeping an eye out for.
The signs really depend on the cat's age, and for little kittens, a big infestation can be very, very serious. You might see that classic pot-bellied look, maybe some coughing, or they just aren't gaining weight like they should. In adult cats, the signs are usually a lot less obvious, but the risk is definitely higher for cats that are active hunters.
And then there are those moments when the evidence is, well, undeniable. If you see worms in your cat's poop or vomit, the description is pretty vivid. And I'm quoting here. They look like white earthworms or strands of spaghetti that are alive and moving. Yeah, not a pretty picture, I know, but it is a crystal clear sign that it's time to call the vet.
All right, we've identified the enemy, we know the warning signs. Now for the most important part, how do we fight back? Let's talk treatment and, even better, prevention.
This is probably the most crucial thing to understand. Prevention has to start early. Because those larvae pass through the mother's milk, she can be infecting her kittens even if her own stool sample comes back negative for eggs. It's wild, right? That's why vets recommend deworming both the mom and the kittens starting at just 3 weeks old, even if the tests are negative.
So the standard game plan is a series of treatments. You start with the first dose at 3 weeks, then a second round follows a few weeks later to take care of any worms that have matured since that first dose. After that, a lot of vets recommend monthly prevention until the kitten is about 6 months old, just to make sure they stay protected.
Now, vets have a whole toolkit of effective medications for this. The one to know for the really little guys is Pyrantel pamoate, because it's safe for them while they're still nursing. Other common meds like milbemycin and ivermectin are usually used once kittens are a bit older, but of course, your vet is always going to be the one to figure out the right plan for your specific pet.
But this story has one last really critical chapter, because this isn't just about our cat's health. This is about our health too.
Feline roundworms cause what's called a zoonotic disease, and that's just a scientific way of saying it can be passed from animals to people. And this isn't some super rare thing. It's actually considered a pretty significant public health concern.
So what happens is, if a human, and this is especially a risk for children, accidentally swallows an egg, the larvae hatch, but then they get lost. They can't complete their life cycle in a human, so they just migrate through the body, causing a really serious disease called visceral larva migrans. This can actually damage internal organs like the liver and lungs, and in the most tragic cases, the larva can travel to the eyes and cause permanent vision loss.
The good news is, protecting your family is actually very straightforward. Number one, without a doubt, is keeping your pets on a regular deworming schedule. Beyond that, it's really just about simple hygiene, covering sandboxes where cats might go, wearing gloves when you're out in the garden, and of course, good old-fashioned throw hand washing.
So now you know. You know the life cycle, you know the signs, the treatment, and the risk, not just to your pets, but to your family. The only question left is, what are you going to do about it? You know the risk, so is your home protected?